and I'll go all the way down the leg. You know, a lot of times with low back pain, people will have sciatic pain. So, and depending on what I'm feeling with my fingers, sometimes I'll stay on one area a little bit longer than another. It just kind of slides along the skin there. Get a nice little reaction. Hey guys, Dr. Will here from Miami Spine and Performance in Hollywood. We're back here with Jessie. We just got her all adjusted, so we got all the joints lined up. Now we're going to do some manual therapy. So I'm going to start with the Jeanie rub here. So a lot of patients will ask me, like, what's the difference between something like this and the Hypervolt or the Theragun? So the Hypervolt and Theragun are percussion massage versus this is vibration massage. So they're just going to activate slightly different receptors in the muscles and affect the nervous system a little differently. So sometimes I'll use both, but I find the big surface area of this tends to work really, really well. So I'll kind of work all through the glute, lower back, middle back. And this is great after an adjustment, just kind of gets the nervous system fired up, gets the muscles awake. So we're going to do some soft tissue work and some cupping. And I'll go all the way down the leg. You know, a lot of times with low back pain, people will have sciatic pain. So we'll kind of work all down the path of the sciatic nerve there. On both sides. And again, we're not really breaking up any scar tissue or anything. We're just kind of getting everything relaxed. Sometimes I'll do it before an adjustment, sometimes after. Just depends on how the schedule is that day. But before I do any manual treatment, I like to get on with something like this and just kind of get the system totally relaxed. So now we're going to get in, and I'm going to use the Graston tool here to do some soft tissue work on the lower back. So I'm just going to kind of work this chunk of muscle right through here, so from the tailbone to the bottom of the rib cage. Particularly these erector spinae muscles, these tend to get a little bit tight all the way out through there, as well as the QL. So come in here like this. And I'll use my tool of choice, and I'll feel the spine, and I'll just get right up along the spine and just work with the tool here. Sometimes I'll go parallel to the muscle fibers, other times I'll go perpendicular. I'm not trying to dig super hard, so I'm not trying to, bruise or anything like that. Just trying to get in and work through the muscle there. And depending on what I'm feeling with my fingers, sometimes I'll stay on one area a little bit longer than another. And we're just looking for that little bit of a reaction there. That skin reaction tells us that we're getting good depth into the muscle. Do the same on the other side. I'm using the dull end of the tool now. Which is going to allow me to get a little bit deeper into the muscle because these are thick muscles. We have 6 layers of muscles here right next to the spine, so we want to try to get all the way down there. And I'll go out here and get to the QL. You okay, Jessie? Work all the way through. And I find that prior to doing any cupping, this can be really, really powerful to do some soft tissue work here because as you can see, a little bit of redness is forming, so we're already getting that blood flow increasing to the surface. And again, we're just getting the muscles relaxed. So then once we put the cups on and we get that big boost of blood flow, the muscles are really going to release at that point. And again, guys, I think it's really important, at a sports chiropractic office like this, we do more than just adjusting. We get in and we work the soft tissue. It's very difficult to, treat issues if all we're doing is just addressing the spine. Because anytime we have spine issues, these muscles are going to be reacting. And so sometimes if you just adjust the lower back, but you don't address the soft tissue, patients may not get better, right? So we try to use a couple different tools here to make sure that we treat an issue, top to bottom. So now that we've gotten in here and we've worked the muscles, I'll usually get in here, kind of go up and down with my thumb, just create a little bit of manual decompression there. So one hand's on the tailbone, the other hand's working up and down. I'll do that same thing on the other side. One hand on the tailbone and just kind of stretch that low back out a little bit. And we are ready to go for the cupping. So I like to use the AccuZone cups here. We do some fire cupping with glass cups, but for the most part I'm using these sports cups because sometimes I'll have patients actually do movements with the cups. Today we're just going to have her relax and take some deep breaths with the cups on. But I get all the way down, start down by the pelvis. Give a couple of pumps there. Same thing there. So you can see what happens is the skin rises up to the surface and then it starts to change color. So we're creating some decompression of the muscle and the fascia there. And that change in color is a rushing of blood flow. So sometimes when these muscles get tight, especially if it's something that's come on over years and years, the muscles will actually lose blood flow and they'll lose oxygen. So then it's hard for them to heal and recover. So we're able to really expedite that process here by using cupping to kind of get an acute improvement in blood flow. So again, I'll go all the way up the spine and then I'm going to put 2 more out to the side here. Kind of where that QL muscle is, right through there. Put a little angle there. The other great things about these cups is you can move them around actually. So you can slide the cups back and forth. So sometimes I'll move the cup up and down, almost kind of get like a massage through there. And so you get that suction all the way up and down through the lower back. It just kind of slides along the skin there. Do that same thing on the other side here. Slide the cup up and down through the skin. It's a really good way to, again, it's all about increasing blood flow. So we're just trying to get these muscles flushed with oxygen and nutrients and everything that they need to recover and heal, so that once we have the spine all aligned, we can get those muscles nice and relaxed, and then the whole nervous system can kind of come together and start to heal itself, right? And you can see here she's getting a really good reaction. So a lot of people ask, what's going on with the darkening? Is it a bruise? What is it? So again, all that's happening is as we're creating decompression in that muscle, we're getting an acute flushing of blood flow. So when I take the cups off, you'll see that those circles will remain, and then usually within 1 to 3 days, kind of depending on how fair your skin is, those cupping marks will go away. But it's not painful, it's not that it's bruised or anything like that. It's just that you're getting blood flow to that particular area. A lot of times, the darker mark that you get is usually indicative that that area has been deprived of blood longer. So if an area gets really, really dark, that's telling me, okay, this is a muscle that has maybe only been operating on 25, 30% of the oxygen that it needs. So usually it's a good thing if we see a really dark circle there, okay? So now we'll go ahead and decompress. And you can see, as I lift up there, get a nice little reaction right through the low back. And again, you can see kind of the darkness on the outside there. And then as we get a little bit lower towards the tailbone, where the root of the issue was, it gets even darker. We'll come out here. I'll take this one off as well. So typically after this, I'll go in one more time now that we've gotten all these muscles relaxed. We'll just kind of drape the towel over. We'll go back to our Jeanie here, just to create some input into the nervous system. Get those muscles relaxed. Now that we've got blood in there, we can move that blood around. We can really relax those muscles. So a lot of times prior to doing any rehabilitative exercises or anything, I'll go through this process with the patient where we start by fixing the structural system. So we're working through the bones and the joints. And then we'll get in and we'll work the soft tissue system, so we'll make sure the muscles are working right. Now her body's in a great environment to start strengthening, mobilizing, stabilizing, everything like that. So generally I won't jump into exercise if there's some issues down here from a joint or a muscle standpoint. I want to clear that out so then she has full and free movement when it's time to do the exercises. So thank you for watching, guys. In the next video, I'm going to show you what types of exercises I'm going to use with Jessie to try to stabilize this lower back.